As a surgeon at the Toronto Western Hospital Bariatric Clinic, I'd like to talk to you about the types of weight loss surgeries that are currently performed in our clinic. The Roux-en-Y gastric bypass, also called the Roux-en-Y, and the sleeve gastrectomy, also called the sleeve. Both have been proven to be effective treatments for morbid obesity. Each takes a few hours to perform and requires a short hospital stay. Let me show you more about the Roux-en-Y surgery that we perform. To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon observes the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine where digestion continues. The upper portion of the small intestine is reconnected to the lower part of the intestine. The bile and pancreatic fluids from the liver and pancreas allow for food to be completely digested. By altering the anatomy of the gastrointestinal tract, gastric bypass changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. In some cases, there is another surgery we do called the sleeve. Just like in the Roux-en-Y surgery, trocars are placed to gain access to the abdominal cavity, and the abdomen is viewed laparoscopically. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is mixed with digestive enzymes to help break down the food to a more simple form, so that it can be more easily digested and absorbed when it is in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 and 150 milliliters, or be about the size of a banana. The excised portion of the stomach is removed. This results in decreased hunger and increased feelings of fullness after meals. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel needed for the sleeve gastrectomy. As with all weight loss surgery, success depends on making lifelong changes to your eating and exercise habits. All surgery has risk. Your weight, age, medical history, and other factors determine your specific risk.